Kelly from North Shore Eye Care. I am sitting with Dr. Michelle Liebert in our Smithtown office, and we're going to talk a little bit about conjunctivitis, which is also known as pink eye. It's extremely contagious. It becomes bacterial or viral, although it can also, I believe, be, allergic reaction, which is then non-contagious. Is that correct?
Mm-hmm.
Okay. So I just want to ask you a couple of questions because I know you see a lot of younger patients that come in with this. Who is typically affected?
Well, more children tend to get conjunctivitis because it's spread through contact.
Mm-hmm.
So kids are messier, they touch each other, whatever, so they tend to get it. Usually children, but adults get it as well.
Right.
So everyone pretty much
Children
gets it.
are probably less cautious about like washing their hands and stuff.
Right.
And how is it spread and how is it prevented?
Well, it's spread through contact, so you can't get it through the air. You have to, and I see it, a child holds their mother's or father's hands, and then that person touches their eye, they're going to get it. So it's very, very contagious. It can also be spread if you touch a grocery cart and someone touches that, you can get it. So it's spread pretty.
Doorknobs, light switches.
Doorknobs, desks at school.
Okay. How is it diagnosed? Is there
Well,
testing?
it's just if someone has a red eye, they by definition have conjunctivitis, and it's up to me to determine what it's from.
Okay.
So if it's from an infection or from an allergy, then it's termed conjunctivitis. If it's more serious, it could be other things. But if you have someone with a red eye, that's the first thing I think of.
Okay. So there's no specific testing though that's required to really
Well,
determine?
not really. There's a culture that's out now, which is for adenovirus, which is the virus that causes the common cold. But in reality, there are many, many different types of viruses, so oftentimes it's not positive. But if it's caused by adenovirus, we have a culture for it.
How is it treated?
Well, if it's bacterial, it's treated with eye antibiotics. If it's viral, really all you need is some cool compresses. You have to exercise contact precautions. If it's an adult, I may place someone on a steroid eye drop just to calm down the inflammation. If it's allergic, you have to treat the allergy, and the best thing to do is just to treat the source. So if you have an allergy to something, you stop your exposure. But there are many allergy drops out there that we can use.
Is it uncomfortable? Does it cause the patient a lot of discomfort? Is there something that could be done for that?
It does cause some discomfort depending on how severe each type is. So some patients are quite uncomfortable.
You can just take like Tylenol or something for that. Is that
Yeah,
correct?
Motrin.
If necessary. Okay. How often do you see patients come in with pink eye?
Almost every day.
Right.
Yes, almost every single day.
Okay.
So in April, May, I see patients with allergies. Almost half my patients have allergies.
Right.
So
it's definitely a little bit more common during allergy season, I guess.
Right.
I figured it was something you would see very frequently with children. Okay. If you would like to come in and talk to Dr. Liebert, we ask that you give us a call at 631-265-8780. She'd be happy to meet with you. We hope you found the video informative. Thank you.